Good day, guys. My name is David, and today we'll be discussing skill and care for monitoring patients with a cast. Now, what is a cast? A cast is a device that is used to immobilize a body part in a specific position. It is also used to stabilize and support unstable joints. It is used to exert uniform compression on soft tissue, and it is used to correct and prevent deformities. Now, we have two types of casts. We have a plaster of Paris, or also known as POP, and the plaster of Paris takes the longest to dry. It usually takes about 48 hours to dry, and a fiberglass dries very rapidly. So in caring for patients with a cast, especially patients with a newly acquired cast, or dealing with patients who have a plaster of Paris, and special care and measures have to be taken in caring for them and monitoring the cast while it dries. Now in this scenario, we have a patient with a leg cast, as you can see, and the first step in helping this patient is to support the cast and also the body of the patient in good alignment by using pillows. So we take the pillows and we just basically support the cast. It is very important we do this so that the cast can be stable, not move too much, and just in good alignment. Another thing we can do to help this patient and care for this patient is, after this, we can elevate the cast. So we take the cast and we place it carefully. And also it is very important to remember that when touching a newly acquired cast or a wet cast, you don't touch it, you don't move it with your fingers, you move it with your palm. So you gradually elevate with your palm and not your fingers, and you're just swooping just help something like that. It should just be elevated, and the way it should be elevated, the foot should be higher than the hip, and for patients with an arm cast, the fingers should be higher than the elbow. Now after this, another good thing to know while caring for the patient is that with a cast, it is wrong when you let a cast rest on a hard surface, a hard and a flat surface. In this scenario, in this case here, the cast is resting on a hard and a flat surface. So this is not right. So avoid doing this. Also, another thing to note is you have to ensure that nothing plastic is placed under your cast. You get, in this scenario, this is wrong. You have to avoid situations like this. Anything at all that is plastic should not be placed under your cast. Another important thing to know when caring for patients with a cast is that you have to frequently turn the patient so that you can permit air circulation to all parts of the cast. Now, as we all know, we have different positions we can turn the patient to. We have the Sims position, left lateral. We have the right lateral. We have the semi-supine position, and you can just turn your patient a little bit. You could turn them to the side and gently move the cast along as you turn them, so that you can permit air circulation to different places in the cast. And also, another important thing to know is that if perhaps the patient needs warmth, right, you can cover the cast very loosely with a sheet. Now we have a sheet here. You just cover very loosely. You don't try to cover it all. Just gently and loosely cover the cast. It is also important to check, for example, now in this case we have a leg cast. It is very important to check the toes of the leg. You check the toes, you observe the toes for decreased circulation of blood, because obviously a cast is in place. And if perhaps you observe something like this, you take so when observing, and you observe, in this scenario we have a leg cast. Now you would observe the toes. You'd observe the toes for poor circulation. And if perhaps you observe and you check and you see that, okay, I can observe cyanosis, you write it down. You inquire from the patient, okay ma'am, how are you feeling in this place? Maybe perhaps you can palpate and ask, ma'am, does it hurt? Is it painful? Let's say, for example, good day, madam.
Good day, doctor.
How are you feeling today?
I'm fine, thank you.
Okay, ma'am, I just want to ask you a few questions. How does your toe area feel today?
Painful.
Wow, very painful?
Moderately painful.
Moderately painful. When you inquire like this, you indicate moderately painful. Moving on, you also check for edema. You check the area around the cast for edema, and if perhaps you observe, you indicate it down. You also check for numbness. So in checking for numbness, what you can do is you inquire from the patient. Again, how are you doing, ma'am?
I'm fine, thank you.
Okay, ma'am, I'm just gonna check your feet in this scenario. When I touch it, do you feel any sensation?
No, not really.
Okay, let me check another part. Do you feel anything now?
No.
No. So when you've inquired like this, you indicate it down. No sensation, she feels numb. Also, you can inquire from the patient if perhaps there's a tingling sensation. In this case, it would go something like this. Good day, madam. How are you feeling today?
I'm fine, thank you.
Okay, madam, that's good. I'd like to inquire if perhaps you have any tingling sensation in your feet.
Yes, I do.
Okay. And can you describe the sensation for me? Is it a recurring sensation? Does it come and go? Is it sharp? Is it low, with low intensity? Can you just describe it?
It comes once in a while.
Once in a while?
Yes.
Like once every hour, once every 30 minutes?
Maybe like 5 or 6 times a day.
Wow. And how long does it last for?
Just a short period of time.
Very short period of time. Thank you very much, madam.
Thank you.
When you inquire like this, you indicate it down and you make sure that you report these findings and these observations to the registered nurse or to your supervisor. Moving on from this, it is also important to observe areas around the cast, areas like this, areas that are not covered with the cast. You check for signs of irritation. And another thing you have to take into consideration is when observing or monitoring a patient with a cast, you always check for color. We have something we call SMET, which C stands for color, M stands for motion, E stands for edema, and then T stands for temperature. So any abnormal findings under these different parameters, you record and you report your findings to your supervisor.